ease the burden and ease the stress. So Dr. Paul Valbuena is here from Valbuena 360 Wellness. He's joining us with some ideas on helping kids get through stress. And we were talking during the commercial break. You say it's always been there, but it seems like maybe we're more aware of it because people are more willing to talk a little bit about maybe some of the anxiety or depression that they're experiencing.
Right. Well, I think the incidence is much higher these days, and I think it's really because of what's happening in today's world. There's been a lot of things, some negative things that have happened due to untreated mental health, and I think now it's really becoming a forefront and really becoming a more important thing to address, especially in our young ones and in our college. In college, suicide is actually the second leading cause of death right now.
So how do we identify this in our kids, or how do we have a healthy dialogue and conversation so that they know that they can come to you as a parent for some guidance?
Right. I think it's important to educate, number one, educate yourself as parents, educate your children. I think the awareness that's happening today, there's so many resources that are out there right now. And I think if we can educate ourselves on how to talk to our children and how to explain to them that, hey, it's okay to feel like this, I think that's going to be very important.
So that's step one.
Right.
What do we need to do next?
Well, after that, I think identifying actually what is the actual trigger for how someone's feeling. And maybe it's a situational stress that something can be addressed internally. But until you actually look into it deeper, you might need to seek help from a mental health provider. Because everyone has anxiety, everyone has some type of bad day. We really look at extremes of depression, extremes of anxiety. And anytime that it affects your normal flow of life, your social functioning, your professional functioning, your academic functioning, you really got to look at that as gauges.
So what would you say to somebody who maybe is experiencing anxiety for the first time? Because it can be a very abrupt kind of feeling, and it can be stressful because you're thinking, I've never felt this before.
Right. I think it's important to also just educate that, I would educate that person that everyone has some level of anxiety. It's actually normal to have anxiety. I think it's abnormal not to have anxiety, but to have the extremes of anxiety, again, those need to be identified.
So we go to a professional and we get some help, and this is something that some people live with for their entire life, but they try to, I don't know if you would say suppress it or try to reduce it as much as they can.
Yeah, what they try to do is cope with it a little bit better through the help of mental health professionals. And I think through time, people learn different ways of thinking. They kind of change the way they perceive things in life, and they can change the way, and you can learn that in therapy and through counseling. And it's not always about medications. It can be very helpful, but I think educating your brain, if you will, and training it to think a certain way, you can do that definitely through the help of mental health providers, and even family and friends even.
Okay, we appreciate your insight. We know a lot of families obviously kind of dealing with that as their kids kind of deal with some stressful times. So thank you so much, Dr. Paul Valbuena, joining us this morning. Kimmy, we're going to send it to you.